Hi, my name is Dr. Jessica Faye from Oak City Chiropractic, and today we're going to talk about whether your hip tension is causing your lower back pain. So one thing I like to evaluate when patients come in is looking at different sections of the body that should be mobile versus sections that should be stable. So I always think about the hips. You want mobility through the hips, in the lumbar spine, so the low back. You really want stability in the mid-back, so kind of your thoracic upper back area. We want mobility, and then in the neck, we typically want to prioritize stability. So just thinking about the hips and their relationship with the low back right now, a lot of times if they're not making progress with chiropractic care or sometimes physical therapy, a missing link is that no one's really getting the mobility back in their hips. So one thing that we do, we'll kind of work through the back of the hip, so a lot of the external rotators of the hip, the piriformis. This is after an evaluation to see what's tight. But you really kind of want to go in and get the glutes looser. Sometimes I'll work the hamstrings if that's indicated with a person. The psoas, which is kind of a deep abdominal muscle, but also attaches to the front of your spine. This can be really key in someone who has lower back pain. And this release usually feels really good if it's indicated for them. Then a lot of times I'll work kind of through the TFL here. This is where a lot of muscles kind of converge and attach right by the hip capsule. And then I'll do a QL release, so I will work the low back too. You just don't want to miss what's going on in the hips. And then if you want to lay on your stomach, we'll do some traction. And then decompression's another aspect of low back care that you want to look at. So just kind of going through, creating some space for the discs and the facets in the low back. And then on either side, addressing, there's a bundle of muscle fibers that runs along each side of the spine. Just really going through, make sure you're clearing out some of the tension in that area. So these are just a few things we look at when we're treating low back pain in the clinic.